Fabulous. Hello, everyone. Good morning. My name is Cassondra Warney from CSH. We're really excited to virtually kick off New Jersey Advocates for Aging Well's conference, and we're really excited to be able to mingle in person tomorrow in New Brunswick. We're going to talk this morning a little bit around how to be able to help folks in New Jersey age in place with assisted living programs and supportive housing. What would be helpful, if it's possible, just to be able to share in the chat what organizations are here today. So then that way we can get a sense of our audience, and then also to be able to say hi in person tomorrow.
And I'm going to do a plug for tomorrow for logistics. The doors will open at just about 8 a.m. We have a great breakfast layout. Come early. We have over 270 registrants, so it will take a while to check in. So please give yourself time and enjoy a fabulous breakfast and come over and meet Cassondra and the rest of our speakers. Now I'll turn it back to you.
Perfect. Thank you. It looks like chat is disabled. So
so I'm sorry for you can put it in the Q&A, and then I will print off lists for tomorrow.
That's true, and I can see your responses. So if you
Yeah.
just want to share in the Q&A, I can get a sense of who's online.
Yeah,
So
thank you, everybody.
what we wanted to do today was to be able to share more about the assisted living program. There's around 13 of these across the state of New Jersey, and we really want to see these to expand. And so we want to share a little bit more about this opportunity, and then hopefully at the end we can chat a little bit around where folks think there might be chances to be able to partner with ALPs, either in existing affordable and supportive housing programs or in new developments that are right now being conceptualized. So just a little bit of background about my organization, CSH, for those who are not familiar. Corporation for Supportive Housing, we're a national nonprofit with a regional team, a metro team that's focused on New Jersey, Pennsylvania, and New York. We are all about being able to increase the supportive housing availability in our communities and the quality of services. We define supportive housing as affordable with voluntary individualized services. Can be for folks who have severe behavioral health needs, folks who might be in a nursing home and could step down if there was a lower level of care, folks who are experiencing housing instability or homelessness. And a common thread across all of those different areas is folks are aging in all those categories. And we did a New Jersey specific supportive housing needs analysis in spring of 2020. New Jersey needs well over 17,000 supportive housing units to be able to meet the demand. And so we are helping out in a variety of different ways. We're a community development financial institution, a CDFI. So for anyone on the line who might be interested in building both affordable and supportive housing, we can help out from the financing perspective. And we also get involved in a lot of trainings, consulting, and policy reform. We actually put out about a year ago an advocacy agenda focused on how to help more folks in New Jersey age in supportive housing. So that's a little bit of background on my organization. And what we're really excited about is that in New Jersey, big picture, there's a lot of really great stuff happening in the aging space. When you look at a lot of local news coverage, a New Jersey Spotlight and others, we're just seeing an uptick in aging issues being covered. There's a lot of advocacy that's been happening around trying to get providers better rates. And we're super excited that that advocacy has resulted in some Medicaid rate increases, which includes the rate for the assisted living program. And we're also really excited what the New Jersey Medicaid office is doing. They're really paving the way nationally when it comes to housing and services. And they just had their 1115 waiver approved earlier this spring, which is essentially the Medicaid office asking the feds, can we do something innovative? And that is going to be covering housing related services, which includes pre-tenancy and tenancy supports, which we view as a game changer for supportive housing, but also affordable housing at large. And there's some just neat things happening at the state level. There's some legislation that's been introduced to advance assisted living programs, which we're here to talk to you about today. And there's a governor's commitment to increasing home community-based services. So big picture, we see the spotlight being on helping folks who are aging age in place. And we really see ALPs as a really big opportunity to be able to help with that.
Cassondra, I'm going to interrupt you for a minute. In the attendance is Rebecca Lynn. There's a Rebecca, but we're looking for Rebecca Lynn. And if that's you, would you just put that in the Q&A? Go ahead, Cassondra.
Perfect, thank you. And let's see, there we go. So zooming out and thinking about where older adults are living. And in this instance, I'm taking the lens of older adults who have some type of subsidized housing. This pyramid kind of gives you a sense of where folks may be at. And at the bottom, you have general affordable senior housing. You know, folks might have a rental subsidy. And at the very top, you have nursing homes, which is the highest level of care. And supportive housing is in the middle in terms of being able to combine that rental subsidy along with those supportive services that person might need to hopefully be able to age in place as long as possible before needing to go to a higher level of care. And so what we would really like to see in New Jersey is more and more choice of allowing folks, if they would like to stay where they're at, what are ways in which we can be able to get them the services to be able to allow them to do that. And I'll make kind of a final kind of plug on supportive housing before turning it off to talk more specifically around what ALPs are, which is that supportive housing targets individuals and households with multiple barriers. So it's really designed for people who, but for housing, cannot access and make effective use of treatment and supportive services in the community, and but for services, cannot access and sustain stable housing in the community. And when I think about a lot of supportive housing that exists in New Jersey, there's a lot of supportive housing supporting folks who have severe behavioral health needs, folks who have developmental disabilities, folks who were previously homeless. I think a lot of the low-income tax credit, LIHTC set-asides that HMFA has financed over the last several years. A lot of those folks are aging now. So, you know, that behavioral health service provider might not, oftentimes does not have the services to be able to provide, say, average daily living skills to be able to support that person. And so we're trying to think, how can we really help people both in supportive housing, but also in affordable housing at large to be able to stay in place? And we do view ALPs as one of the solutions. So with that, I'm going to hand it over to either Candace or Rebecca.
I'm going to tell you, Rebecca, I can't promote you to panelist for some reason, so I have resent your link. It's coming from Zoom, not from me. So sorry, everybody, for that, but
I'm
hopefully
here.
that brings Rebecca to us. You're here?
Yes, I can't figure out how to. Oh, there I am.
Ah, thank you for.
Perfect timing.
All right. And before you go, we do have a couple of questions. One question, Candace, is what does pre-tenancy mean? Can you define that more clearly? And also, and Rebecca, you might be covering this, but how does the Medicaid waiver that was approved this spring, what does that do for ALP sustainability and expansion? So you might be covering that next, but if you could just define pre-tenancy for us.
Yeah, so pre-tenancy are ways to be able to help people to access housing. And a really big example of this would be housing navigation. So helping folks be able to search for apartments, dialogue with landlords, and get people housed. The question on how the approved way, and I'll also say that while this is approved and we're really excited about it, a lot of those details we won't know for about at least another year. Right now, the Medicaid office is being very transparent and in just terms of they're thinking through implementation. They're setting up a couple of different work groups to figure out who's going to be eligible, both in terms of the providers providing the housing related services, as well as the Medicaid members. So there's a lot of unknowns, and I don't have a direct answer for ALP sustainability and expansion. I know that they, and Rebecca can talk more about this, they did receive that wonderful rate increase. But that could be a question that we can make sure to ask when we're dialoguing with the Medicaid office and other stakeholders through those various work groups that they're going to have started, I think, by the end of the summer or early fall.
Okay, thank you. All right, we're going to turn it over to Rebecca, and we'll go through the questions at the end. So as we, as the questions come up, please put them in the Q&A, and we will have time at the end to go through.
Good morning. My name is Rebecca Lynn. I am the volunteer executive director of Assisted Living, Inc., and I run a licensed assisted living program in an apartment building that I built in Ewing, New Jersey. Am I in charge of the slides? Because I don't know how to do that part either.
I will move them along for you.
Okay, thank you. So the New Jersey Assisted Living Program is a licensed program, licensed by the Department of Health and Senior Services. And any program that exists has to follow the rules and regulations of the state of New Jersey. They are not onerous. They're very practical. They were designed and developed by nurses in the 1990s, and they haven't changed much, if at all, since then. So because I am both a housing provider and an ALP provider, I can talk to both sides of the fence. So a housing provider will own and manage an apartment building. It has to be publicly subsidized, and a publicly subsidized apartment building can be subsidized with low-income housing tax credits, tax-exempt bonds. There are various and sundry ways, and all of your funding does not have to be subsidized. Any portion of the funding for the apartment building is if it's subsidized, counts. So the housing provider manages, runs, takes care of the apartment building. That is not the responsibility of the assisted living program provider. The housing provider will have residents that age in place, and those residents will need assistance over time. And the housing provider, to prevent them from losing tenants, can refer those folks who are maybe forgetting to pay their rent or have an issue with keeping their apartment clean or having a pest issue. They can refer those tenants to the ALP provider. They may have a service coordinator on site that works with the assisted living program provider. I believe the HMFA is pushing this. I'm not sure about HUD. I think HUD also helps with that. So depending on what the housing provider funding is, the housing provider also maintains the affordability of the senior housing units. So again, all of that falls on the housing provider. If a housing provider management person wants to open up their apartment building to the assisted living program, these are the benefits you get from it. So if that happens, there's a partnership agreement that gets put in place. The housing provider says that they're not going to move people left and right to different apartments. All apartments, the resident ages in the apartment that they move into. There are other partnership agreement issues, and that's also part of the licensure process. The state of New Jersey has a say in what goes on with your partnership agreement, but you should also include how many times a day or a month or a year or whatever you're going to communicate with the ALP provider as a housing provider. The two of you have to have a written agreement that everybody understands and then works with. When you're working together from the housing provider and the assisted living program provider as a team, you're all the residents in your apartment benefit, whether it's people on the ALP or people not on the ALP, because people on the ALP, other residents see those people aging in place and staying in their apartment so that they can have the knowledge that they're not going to get kicked out when something happens to them, or they can have the services and stay in their apartment with all of their friends and stay in their community. So assisted living programs. Assisted living programs require 24-hour staff on site. And that staff person on the overnight shift can be your security guard, or if you have another awake staff person, in case there's an emergency, that person can be part of the ALP provider grouping. ALPs are required to have 24-hour staff in the building. So it is a licensed service. In my program, I am the RN in addition to the executive director, and I assess my residents prior to them coming on the program. I often assist them in getting Medicaid to be on the program. I also go out to nursing homes and assess residents that want to move into the program. And this is all in conjunction with the housing provider, because this is a low-income housing tax credit apartment building. This is the building that I run my program in. And there are rules that the management company has to follow. Every resident's on a list. And as they're selected on the list, they get a letter, and then, the wait list. As the wait list goes down from person to person, the housing provider sends them a letter, and then that person will reach out to the assisted living program and say, guess what? Here I am, and I am on the list, and they told me I can get my apartment. Then we work on working with the managed care organizations, and through I Choose Home, if they're in a nursing home at the current moment, and for I believe it's 3 months or more, the managed care organization will actually furnish their apartment, from silverware to couches to everything, to lamps, to bedding. Managed care organizations will actually set this person up with an apartment that they can actually live in. They don't provide the TV, and they don't provide a vacuum. That's essentially the only things they do not provide. So working in conjunction with the housing provider, we can get residents who want to move from a nursing home into the community. So I assess each individual prior to them coming on the assisted living program, and then we develop a care plan. And the care plan is the information that my staff have in order to provide the appropriate care for each resident. We have most of our residents, I believe we're 100% Medicaid at the moment. Some residents will pay privately for services for a period of time until they get on Medicaid. Some residents, well, we're in affordable housing, so we don't have a lot of residents that can privately pay for their assisted living forever. And we work in conjunction with the family if the resident wants us to. So it's their life, their choice. And if they don't want us to talk to the family members, that's a violation of their rights, and we wouldn't do that. Most of the time, we are able to talk to family members and coordinate doctor's appointments and making sure that everybody works together. So at the bottom, you'll see ALP services include 12 to 16 hours, 7 days a week of on-site staff, overnight access to the RN. Actually, it's 24-hour access to the RN. The staff must have access 24 hours to that nurse, whether it's by text, by phone. It matters. That matters, because when the state comes in and says, how do you access your RN, you have to explain to them. So my staff, a lot of what they do is provide support. So we make sure their apartments are clean by doing housekeeping and laundry, strip their beds if they can't do it on their own, help them with the shower if they can't do it on their own, help them get dressed, help them to make sure they take their medications appropriately to keep them in the apartment and safe. If they need meal prep, we help with that. care plan management, we do that as well. So we also arrange transportation. So it's bathing, dressing, grooming, med administration, meal prep. We do a lot. So our philosophy of Assisted Living Inc. is that we want our residents to do as much as they can for themselves. So if they can vacuum, they vacuum. We're not taking all of that away. If they can take their own medications and do it correctly, then they take their own medications. If they can dress themselves, then they dress themselves. This is not a nursing home. These folks are individuals that live in their own apartments, and they call for services when they need them. All right, Cassandra, can you move along, please? Okay, so 24-hour on-call assistance. Again, ALP regulations require 24-hour staff, and the overnight staff can be the building security guard. What we've learned, I've been doing the ALP since 2010, and we have very infrequent visits to the emergency room. We had somebody in the building on the ALP for 12 years before he went into the emergency room. So he's safe, he's in his apartment, he's paying rent, his apartment is clean, everybody wins. He wins, management wins, ALP wins, he's out of the nursing home because that's where he came from. Everybody wins. We already went through that. So I also do, I'm a big fan to work with all of the tenants of the apartment building to do low income housing, heating and energy assistance program, LIHEAP. I encourage residents and post information about SNAP, which is the food stamps. We just found out that tenants can, in subsidized housing, can actually get an agreement with the solar group to reduce their electric bill. So we're going to work with our residents to let them know about that. And you should investigate as well, because all low-income housing projects in New Jersey, I believe, are qualified. The managed care organizations will provide home delivered meals, the Life Alert, and they will also pay for incontinence supplies. So if someone needs incontinence supplies, the managed care organization will provide those supplies. The assisted living program orders them and make sure that the prescription comes from the physician to get those incontinence supplies. Again, working with your assisted living program tenants, you can protect your apartment building. So if somebody has an incontinence issue, refer them over to the ALP. That protects your furniture. It helps with the odor in the apartment building. Urinary incontinence is not a normal part of aging, so we would work with their urologist and see if we can't eliminate the urinary incontinence altogether. And then if we can't, we use incontinence supplies. We are in Mercer County, so we have access to trade transportation. So and Access Link. Everybody in the state has access to Access Link, as long as they're near a bus stop, which is also important for an ALP to get staff if they're not in walkable distance to get some of my staff don't have cars, so they use the bus. And then other social supports. So we work with, I can't remember what it is. It used to be Oaks Behavioral Health, and I'm not sure if it still is. So we have a fella that comes in once a month and does anything that the tenants are looking for. Most recently was how to help you sleep better. Referrals and resources in the community that residents in the apartment building can use. And it's open to all tenants. It's not select, only the ALPs are invited to this. It's for everybody. Yeah, that emergency response. COVID was rough, but we had people who moved out to be with their families instead of staying in the apartment building alone, which I thought was wonderful. Again, it's about the residents' quality of life, not about the ALP bottom line. So we helped with bringing meals to their apartments. We tried all kinds of different things on recreation and trying to social programs and keeping people active and helping them talk to their families and do the best we could with the situations that we had. Assisted Living Inc., our mission is to provide assistance and support to enable folks to age in place. And the 5 tenets of assisted living is dignity, individuality, privacy, independence and in their own home. So the apartment is designed for, the apartment is decorated the way they want to decorate it. The assisted living program has nothing to do with that. Management issues, if there's a, a sink that leaks, that has nothing to do with the ALP, but the ALP can contact the management company and let them know, hey, we have a dripping faucet, so they can address it before it becomes a larger problem. So it's a symbiotic thing. All right, Cassandra, what have you got next? So I witnessed the need for affordable assisted living because I was a visiting nurse for a couple of years in New Jersey. Loved my senior citizens. But I also found out they were alone and lonely. And our local assisted living facilities at the time were probably between $6,000 and $8,000 a month. And my folks couldn't afford that. I didn't want to work for anybody else. So it took me 12 years to develop the Ewing Independent Living Apartments, and used information that I gleaned from lots and lots of different people, particularly Anna Auerbach at the HMFA, who said, at the time it was 2007, 2008, actually, sorry, it was 96 when I started this. And the assisted living facilities were going under because they were too expensive and I couldn't get financing. So it was suggested that I do an apartment building and put the assisted living program in the apartment building. So if the assisted living program didn't work out, the apartment building would still be functional, which it is. So our building is 55 and over, and we have 12 set aside units for adults over the age of 18 who have developmental disabilities. And Assisted Living Inc. has worked with DDD and become a provider for DDD as well. So we have ALP folks in the building, and we also have DDD folks in the building. All right, Cassandra. Our mission. So I went over this already. So we have, we enable seniors and adults with developmental disabilities to age in place. So in their apartment, they don't get moved from one apartment to another. This is not a segregation thing that you move all your assisted living program people to one floor or one side of one floor. No, this is individuality in their own apartment, the one they moved into, for as long as they stay in that apartment. All right, Cassandra. So again, the housing provider owns and manages the apartment building. That has nothing to do with the assisted living program. So they are two separate entities that work together. The housing provider maintains the affordability. They're responsible for dealing with their funding sources, their low-income housing tax credit investors and the HMFA or the DCA or whoever's funded your apartment building, your HUD, your public housing authority, anything like that. The housing provider has to have a written agreement with the assisted living program provider. That is part of the licensure, but it also makes the two entities work together well. If your housing provider has somebody to talk to, if there's a tenant who has an issue and you don't want to evict them because it costs the housing provider money to evict someone, you've got the attorney fees, you've got the fact that they're not paying rent for the time that they're being evicted, you have the turnover fees, you have to change your carpet, do your painting, you have the vacancy time frame that you have the eviction, and then you have to re-rent the apartment. There's a lot of cost involved to turning over a unit. And if you have a tenant that just needs some supports and you can keep them longer, the housing provider saves money, makes money by having the assisted living program in the building. Because I designed the building, I made sure that we had activity space and office space for the assisted living program, and refer residents when necessary to the ALP. So again, if you have a tenant who has issues, you want to refer them to the ALP with the family's permission or the tenant's permission, and work together as a community to help that tenant stay in the apartment building to save everybody money. And then the assisted living program. All right, Cassandra. So the provider has, again, the detailed written agreement with the housing provider. So that it is, again, symbiotic relationship. The ALP must follow the regs mandated by the Department of Health. keep the ALP areas and the apartments clean, act on referrals to assist residents and the housing provider, arrange activities to keep residents active and socializing, manage with the managed care organizations, managed care long-term supports and services. That's the MLTSS that's there. That is a program through Medicaid, the MLTSS, and that's been in existence since I've been in existence. It used to be called Global Options. So it's changed and morphed, but it's always been available since I think it's 1997, the ALP waiver has been in place. We also have residents that privately pay. So our assisted living, we have a program that provides 24/7. We also have an a la carte program. So if somebody just needs a shower 3 times a week, they pay for the shower 3 times a week. If they need medication supervision, hey, just remind me to take my medications 1 time in the morning. We can do that. And they don't have to be on the full ALP. They can be just get services a la carte. So this picture is, this is 4th of July, and we were lighting off fireworks because they became legal in New Jersey. The beginning of COVID, I think it was, this picture. All right. So we, because we have very few people on our assisted living program, at this moment we have 7. It's not cost effective for us just to have the assisted living program. We do the a la carte assisted living services, so we have a little bit money coming in that way. We also do, we work with folks with developmental disabilities, so we get funding through that. We are doing weekday meals, which provides the socialization, a nutritious meal, an activity for the residents to participate in with each other. We do a social day program, which is an unlicensed program that is also paid for by the managed care organizations that, again, provide socialization. We do exercise and coffee, provide a lunch, and then activities, indoor bowling, outdoor. We have a bocce court, we have a shuffleboard court, we have a garden. We do all our activities through the social day program. And then we facilitate transportation. So through Medicaid, all of our people are on Medicaid. There is a transportation company called Motive Care, and the state of New Jersey pays for that transportation, and we arrange the transportation. So we will facilitate the resident going to their doctor's appointment, and that way they get to and from without issues, and mostly without issues. And then we facilitate them getting home and then coordinate with the paperwork that comes back from that doctor's appointment, what kind of care they get. ALPs are fantastic. If you can't get that from my presentation, I apologize, but they're wonderful. The assisted living program is an extraordinarily beneficial program for all apartments subsidized in the state of New Jersey. If you can, each assisted living program is licensed for their county. So I'm licensed for Mercer County, but I can also work with an attached county. That's how the licensure works, which is odd. So I could do Burlington, or I could do, I guess it's not Hunterdon. Yeah, it's Hunterdon. So whatever's attached around me, I can do another, assisted living program elsewhere. So the partnering with the ALP, there are separate and integral parts of a symbiotic partnership. ALP has ALP rules, housing provider has housing provider rules. They can work together, but the ALP is not dealing with leaky faucets, and the housing provider is not dealing with somebody's incontinence issues. What the benefits? So familiar and consistent staff. The apartment building knows who to contact for what. So there still can be random other staff from other agencies, but they at least have one provider that they can go to and say, hey, this might be an issue. Can you meet with us with this tenant and see what services you might be able to provide and how this can all work together? Because if you have a ALP in your apartment building, you can't kick all the other providers out. That's not legal. I don't think that's legal anyway, but some folks have had a home health aide that they've had for 15 years. They're not going to want to get rid of that home health aide. But if that home health aide leaves the agency that they're with and they retire, that person still needs services. And if you have an ALP, they can join the ALP and get the services that they need without having to leave the building. Familiar and consistent staff. Okay. Energetic, strong, and safe residents. We have an exercise program. We encourage the residents to move. We are in the apartments once a day, at least, checking for any, bugs. Our motto is no bugs, no odor, no wounds. So my staff are in there seeing eyes on residents, making sure everybody's a-okay, and finding issues. Maybe, someday we might find out, there's a leak in the ceiling. We can get the management company to know, hey, there's drip. They can address it before it becomes a giant problem. Happy families. Our families love our assisted living program. Happy staff. That's important. The apartment complex becomes a community. So we have a group of folks that come to activities and they talk to each other, and it's a really nice place to live for everybody. And the bottom line is the housing provider benefits because they keep their tenants in longer. Their tenants are happier. There's less complaints. They don't have to deal with complaints because things are addressed quickly and everybody wins. Anything else? We've got Cassandra. Okay, so Assisted Living Inc. is part of the ALP Provider Coalition. There are very few of us in the state of New Jersey. There are 9 existing programs that accept Medicaid. I understand that there are a couple more that do not, but we are few and far between. And there should be, not we need, but there should be in most senior buildings, this assisted living program, because again, it keeps the resident in their apartment safe with a community that they already live with. So if somebody's been living in an apartment building for 20 years, they don't really want to move, I would think, to a nursing home where they're people they don't know and they don't have their own space. The apartment building provides their own apartment and their own decorations, their own space where they can just go and just be quiet if they want to, or go watch whatever movie they want to watch in their own space. So the Assisted Living Program Coalition, you can Google us. There's a nice map of where we all are. What else do we have, Cassandra? All right, here we go.
I'll also mention if you want to join the ALP coalition, you can send us your email, and we'll be tabling tomorrow. Kathy, I know we're at time, but could we just take 5 to 7 minutes to answer some questions and still give folks a little bit of a break before the 11 a.m. starts?
Yeah, definitely. And again, I've been trying to figure out the chat function. So and I think we covered most of the questions in the Q&A. So if you go through now, and you had a lot of positive feedback, put the questions in the Q&A now, and Cassandra and Rebecca can respond to them. And we will, we have like 10 minutes and then we'll do a 5-minute bio break.
Perfect.
All right, so I see Susan Hoskins. What if the resident requests a move such as to a first floor apartment? That is a management issue. All tenants can request moves. They have to work with management to do that. Maria, hi Maria. Some owners have an agreement with a property management company to manage the building. In this case, would the building be exempt from having an ALP service? I don't know what that means.
I could probably let Maria talk. Maria, would
Okay.
you be up for that if I can find you on here? I think I have the power to let you talk. There's always something new to learn.
I Choose Home corrected me. It's a 2-month stay for nursing facility residency to move to the move to an apartment with the ALP services and get their apartment furnished.
So Maria, if you are able to see if you can talk now to ask your question.
Yes, can you hear me?
Yes.
Part of one of your slides says that the owner must manage the building. That's why I asked that question.
Oh, no, it's you. So the housing provider has most of them have management companies. So the management company is who you have your agreement with. You want to make sure that you have everybody understands everybody's role.
Okay, great.
So I may be misspeaking. I don't know who the agreement has to be with, if it's the owner or the management company, but the management company has to abide by the owner's rules. So if the owner has an agreement, I'm not sure, Maria, if it's with the owner or if it's with the management company.
But it is allowed that the owner can have a management company who manages the building.
Oh, absolutely. So again, two separate entities. The building is the building and the ALP is the ALP.
Great, thank you.
Yep, absolutely. No, Fortunata Campbell, I'm sorry if I'm saying your name incorrectly. These apartments would not be available middle income older adults. Okay, so apartments, we are a low income housing tax credit apartment building. So again, this is my housing provider hat, not my ALP hat. So apartments in this apartment building are based on an income test, not an asset test. So if the person gets Social Security and has $1 million in the bank, they qualify to move in. So it's the income off of that asset that gets calculated in the move-in. So it would be the interest off of that $1 million that they get every year added to their Social Security. There's a max income amount that someone can have per year. So middle income older adults, yeah, we can accept that middle income older adult depending on their income. So it's an income test, not an asset test. So in this building, I don't know how many people are Medicaid eligible, but I would say less than half. Unfortunately or fortunately, it's one of those, sometimes the middle income older adults get stuck because they don't get the Medicaid and they can't afford the assisted living facilities.
But Rebecca, that seems like it's a good way to fill that gap.
Yes,
It bridges
indeed.
that gap.
Yes. And we've considered adding, because all of our apartments are maxed out at 60% income. And if I recollect correctly, it's $50,100 at a 60% income for one person. So income, so that's almost $4,000 a month income, and they can still move in, if my calculations are right in my brain. Are the services from Oaks free? Yes, Steve comes in from Oaks free. What is the income level required to participate? All right. So Medicaid has an asset maximum of $2,000 in the bank. They do not have an income limit anymore. Governor Christie took that away. I think it was him and his group. So there, if you make more than, I learned yesterday at the presentation was $2,754 a month. If you make more than that, the difference between what you make and that $2,754 goes into a qualified income trust. And then when that person passes away, that money moves over to the state of New Jersey. So for Medicaid, the issue is the $2,000 income limit. And I've been working with a bunch of people, great groups of people on testifying in front of the Senate and the Assembly to get rid of that or increase that income level, because people don't want to give up the difference. They want their rainy day fund of $5,000 if something happens to them, and they can't have it if they're on Medicaid, which makes no sense in this day and age because you can't get much for $2,000. How can we motivate housing providers to partner with ALPs? I cannot answer that question because I would love to know the answer to that question. I think it's more disseminating the information and letting them know that they can do this without an expense to themselves. Do you help private pay individuals to MLTSS? Yes, I absolutely do. I help people get Medicaid. That's just who I am and what I do. And I've been doing it for a long time, and the process is really fast now. It used to take months and months and months and months. And if you don't get your paperwork back to them quickly enough, your application is denied. So you want to make sure that you have people that are, let's see, I appreciate you, sir. People don't know. How about people with mental illnesses? A lot of our folks have mental illness because it happens as they age in place. So they we have people with a, you know, some dementia or some mental illness.
Rebecca,
Yes,
if you scroll down, also dementia.
Yeah,
Not
so-
the dementia, mental illness are the same.
so it's a safety issue for folks with dementia. So if someone has dementia and they've lived in the apartment building for 30 years and they're not going to walk out the front door, we can safely take care of them. If they're going to walk out the front door and their dementia is that bad, this is a regular old apartment building.
Right,
So
right.
we can't lock the front door so people can't leave. So I think somebody asked if there was a lock unit. No, there is not. This is an apartment building. This is a regular old apartment building. People come and go.
We have a couple of hands raised, so I wanted to go to Dr. Sharma had her hand up for a question. If you're there, Dr. Sharma.
Yes, hi. Thank you
Hi.
for this presentation. I'm sorry I did miss the first 15 minutes because I was, otherwise occupied, but very nice presentation and very informative. How many such agencies are there in New Jersey?
There are 9 Medicaid accepting ALPs, and I believe I was told between 13 and 15 total in the entire state of New Jersey.
And you said 9 in where?
9 that accept Medicaid,
Okay.
and between 13 and 15 total in the entire state of New Jersey.
So what is the difference between assisted living ALPs and assisted living facility by itself?
Okay, an assisted living facility, all the residents in that facility are in the facility. So the facility has control over everything. They don't have their own apartment. They have about, I think it's 110 square feet of their own space. Some of
Right.
them are shared units.
Mhm.
So they have a room with a bathroom, and then their meals are communal and their activities are communal. In an apartment building, it's an apartment building. It's like anybody else go into a 55 and over apartment building anywhere in the state. You have your own apartment, your bedroom, your living room, your bathroom, your kitchen, your space. And you can come and go as you please. This is your apartment, you come and go. And the assisted living program staff come to your apartment to provide your services.
And what is the so basic what I'm hearing is that it is a active adults community with perks of maintenance of say the yard, building management, presence of a allied health professional, including a registered nurse, access that could potentially be a phone access,
Correct?
and a social worker that takes that helps you do MLTSS paperwork if that is desirable for your situation.
I don't have a social worker because there's not enough money for it. So I am the executive director, I'm the
Okay.
RN, and I'm the social worker. Yeah. So we also refer folks to DACS, which is the Division of Aging and Community Services, for assistance in getting their Medicaid application done, but I also help my residents do their Medicaid applications.
So the a poorer cousin version of it would be to say that if there's a family member that the patient is living with and managing their day-to-day activities, etc., and are being given a service charge by CMS for managing their homemaker needs.
I'm
Did I
sorry, I
say
don't
that
understand the
correctly?
question.
So in other words, if somebody's living in a house with their child, for example, somebody has a grown-up daughter that they're staying with, and that person would, the payment model for that person is that they get service charge from CMS for managing their home health services.
Okay.
am I describing it sort of correctly? A poor cousin version of the system that you have, you know?
I
yours-
think, yes,
Ah,
because the staff would take the place of the family member, the ALP
Right.
staff.
Okay,
Yep.
that helps tremendously. It's a wonderful concept. I hope this takes off and becomes bigger, because
Agreed,
much need for it.
Yeah, thank you.
agreed.
I
Thank
know
you.
we're at time. We will be sending out the presentation, which includes Rebecca's contact info. And I really hope that we can see you in person tomorrow in New Brunswick. We'll have a
Yeah,
table.
yes, of
available.
course. Fantastic. Yes.
And there
Thank
are a
you,
couple of
Rebecca.
hands up that we didn't get to. I encourage you to visit them at the table tomorrow. So we are going to take a pause, come back at 11 o'clock, and we will start talking about technology.
Thank you.
Can I sign back in?